My name is Callie Hunter. I'm the Skills Lab Coordinator at North Central Missouri College, and I will be demonstrating how to do an adult head-to-toe assessment. So first thing that I want to do is I'm going to knock and enter my patient's room. Hello there, Mr. Jones. My name is Callie Hunter, and I am going to be your nurse today, and I would like to perform a head-to-toe assessment on you. Would that be okay to do at this time? Okay, and he says that that's fine. Can you go ahead and verify your name and date of birth, please? And it is Daniel Jones, okay, and your birth date. Good. So those are all accurate. Mr. Jones, next thing that I'm going to ask you is, you've told me your name at this point. Can you tell me where you're at right now? Okay, and he does state he's at North Central Missouri College. Can you tell me the date and what season it is? Okay, and he does verify that it is September, and that he does verify that it's the season of fall. Mr. Jones, can you tell me right now, are you in any pain at this point? Okay, and he does say that his right knee is hurting a little bit. Mr. Jones, can you rate that pain for me on a pain scale from 0 to 10? 10 being the very worst pain that you've ever been in. And he states it's about a 5 at this point, okay? Mr. Jones, is there anything you do that makes it better or seems to make it worse? We can try to elevate it on a pillow a little bit and try to reposition it and see if that helps with your pain some. And he says that it's worse with activity and exercise. Mr. Jones, do you take any medication for your pain at this point? And he says no, he just rests. And just in one descriptive word, can you describe it? Is it achy or dull or a sharp pain? And he says that it's an aching pain. Okay? Well, Mr. Jones, I'm just going to reposition it and put it on a pillow, and we'll see if that helps, and I'll check back with you. Okay? Next thing that I'm going to do is I'm going to take a look at your eyes here. What I would like you to do is just look straight forward here. I'm looking for what's called perla. Okay, so I want to be sure that his pupils are equally round, reactive to light and accommodation. So I'm going to shine this in his pupils, and I'm assessing on both sides to ensure that they are constricting and dilating when I put light in their eyes and when I remove the light, okay? I'm also going to have, if you can, Mr. Jones, I'll just have you look at that clock up there on the wall. Oh. And what I'll have you do is I'm just going to put my finger in front of your face here, and I want you to go ahead and look at the clock on the wall, and then I'm going to have you look back at my finger, okay, and then back at the clock on the wall. And as he's looking at that distant object, I can see that his pupils dilate, and then as he comes back to my finger, I can see that they constrict, which tests accommodation. So at this point, I would say, Mr. Jones, that your pupils are perla and they are intact. Mr. Jones, can you tell me real quick, do you wear glasses or contacts or anything like that? He doesn't, okay, only reading glasses, okay. Next thing that I'm going to do is just take a quick peek in your mouth here. It looks like your mucous membranes are pink and moist. It looks like that he has his own teeth at this point. I don't see any sores or abrasions. Do you note any sores or anything like that in your mouth? Okay, and he states no at this time. Next thing that you may want to do is I'm going to ask Mr. Jones if he has any sinus drainage or anything like that. If your patient does state so, you may want to kind of palpate their sinuses a little bit to see if they have any pressure. If they don't, that is something we don't typically do with every head-to-toe assessment. I will go ahead and take just a quick peek at his ears real quick on each side. I don't see that there is any earwax or anything like that. Mr. Jones doesn't appear to have any hearing deficit. He can understand and respond to my questioning. Mr. Jones, I'm just going to verify, do you wear hearing aids or anything like that? And he states no at this time. Okay, Mr. Jones, next thing that I'm going to do is just take a quick look at your neck here. I can see that your trachea is midline. It's not deviated to one side or the other. I can also look at your chest here, and I can tell that you're symmetrical. I would have him sit forward and just inspect his back as well. It looks like he's symmetrical there also. I am watching him breathe. It looks like his chest is rising and falling symmetrically, not asymmetrical or anything like that. Mr. Jones, are you having any difficulty breathing at this point in time? He states no. How about a cough? If he does have a cough, I may ask, is it frequent, or does it just kind of come and go? Do you have any sputum production? If he does, I may clarify the color and consistency of that. And at this point, he does not have a cough and he doesn't have any sputum production. Next thing that I want to do, Mr. Jones, is I'm just going to take a listen to you here. So I'm going to have you take a deep breath in and out, okay, as I'm listening. Okay, and I'm just going to show you the placement of my stethoscope. I'm not going to have him breathe in and out each time. So I would have him take a deep breath in and out. Okay, take another deep breath in and out, and I'm being sure that I'm listening all the way through the end of exhalation, just because sometimes there are some adventitious sounds that we pick up at the very tail end. I'm going to move my stethoscope down, and as you can see, I'm going back from side to side, and that way I can compare each side to be sure that I'm hearing properly. So there's 6 spots there. I'm also going to come around to the sides. We also have lobes there as well that we need to listen to, and make sure that you get listen well on both sides, inhalation and exhalation. Okay, so once I've done that, I'm going to lean Mr. Jones forward and listen on his backside as well. The other thing is, if you have a patient maybe that has difficulty breathing, at this point you may need to give him a break. Okay, sometimes doing all those breaths is difficult for some patients. So I'm going to lean Mr. Jones forward. Always be sure that you're listening skin on skin. I'm not going to listen over the top of his gown or over the top of his clothing. So I'm going to lean him forward, and I'm also going to listen on his backside. So have him take a deep breath in and out, a deep breath in and out. And as you can see, again, I'm going back and forth, side to side. Okay, and really you're going to be able to hear the greatest on the backside. So don't ever forget to turn your patients or have them set up so you can listen on the back side. And I'm doing about 8 spots on the back side, and I'm kind of curving around to the side to be sure that I listen on each side as well. Okay, once I've listened, I'm going to lay him back. Okay, next thing that I want to do is also, I've looked at him, I've listened. Okay, so you just kind of want to feel and make sure, again, everything, the bony prominences, everything like that are okay, and I don't feel anything abnormal at this point in time. Okay, so next thing that I'm going to do is assess his heart. Okay, we have 5 different locations. We are just going to be discussing 4, okay, in particular. So it's important to know the location and the names of these places. So the first one is going to be the aortic, okay, and it's 2 intercostal spaces down, okay, from the clavicle. So that would be the aortic. Pulmonic is on the left side as well, 2 intercostal spaces down. I'm going to listen there as well. Okay, so aortic, pulmonic. Okay, we're not going to discuss the herbs, but we'll discuss tricuspid. Okay, so you're going to come down 5 places here. Okay, right along the sternum. Okay, come down to your 5th. You're going to listen here, and then lastly you're going to listen to the aortic, okay, which again is that 5th intercostal space left mid-clavicular line, apical, excuse me. So let me do that one more time. So we've got aortic, pulmonic, tricuspid, and apical, okay, is your last spot to listen to. So once you've assessed those heart tones, be sure that you're listening for that lub-dub, okay, and you're documenting that S1 and S2 is what we're hearing. So we're hearing those valves close, and we're hearing that correctly. Next thing that I may ask Mr. Jones is if he has any type of chest pain, any type of dizziness or anything like that that's causing him problems. You're also noting if he's got any scars or anything like that. That would give us an indication if he would have any type of open heart surgeries or anything like that. And at this point in time, I don't see anything. Next thing that I'm going to do is I'm going to move down to the abdomen. So first thing that I want to do, again, you're going to look first. So I'm just going to look at his abdomen. I'm looking for any type of scarring. I don't see that he has any type of ostomy or anything like that. Next thing that I want to do is listen to his bowel sounds. Your belly button kind of cuts you. It is like your crosshair, so we're going to make that into 4 quadrants. So these would be your upper quadrants, these would be your lower, and I want to listen over those quadrants. Okay, I should hear kind of a gurgling, clicking sound, and this ensures that I can hear peristalsis and things are moving. So I'm going to listen in all 4 of those quadrants, okay, to be sure. You could document this as hyperactive, which would be overactive bowel sounds that you could really hear. You could document this as just active, which would just mean that we can hear them, or hypoactive, which means it was very difficult for you to auscultate. Next thing that I want to do is kind of lightly feel on his abdomen, make sure that I don't feel any masses or anything like that, and at this point I don't. Okay. Next thing that I may ask Mr. Jones is when his last bowel movement was. We want to ensure that our patients are having bowel movements at least every 3 days or so. Another thing you may ask, and his last bowel movement was yesterday, is Mr. Jones, was that a form stool, the consistency of it, and also if that was normal for him. Do you normally go daily? Do you go every other day? And that way we can verify that his bowels are working like they're supposed to. And he does go on a daily basis. So next thing that I'm going to ask him is just some quick questions about his urinary tract. Mr. Jones, are you voiding okay? And he says yes. Normally goes about every 2 hours or every 3 hours. Says that he's got clear yellow urine, hasn't really noted any odor, and isn't having any difficulty that way. Okay. Next thing, Mr. Jones, is I'm just going to look at your legs and feet here. So as I'm looking at his feet, I'm just evaluating the color here. It looks like his skin color is pink. They are warm to touch. I don't see any abrasions or sores or anything like that. I'm going to feel with my fingers here up his calf to ensure that he doesn't have any edema in his legs. You could look for any type of swelling that could be documented as pitting edema or non-pitting, and he does not have any pitting edema at this point. Next thing that I want to do is palpate my pedal pulses, and they are palpable, and I would say they're normal at +2, so he does have good pedal pulses. I may go ahead and check his cap refill here real quick on his feet, and it is less than 3 seconds, which is good. I'm going to go ahead and have him push against my hands to check his strength here and make sure that they're equal. They are equal and strong, and I'm going to have him pull back against me as well, and they are equal and strong. Okay. The other thing that I may assess for is Homan sign. This is to check for any type of blood clot or anything like that. So I'm going to have him pull his foot back. So he'll kind of pull his foot back towards his nose. And I'm going to ask if he's got any pain or tenderness in his calves. Okay, and his is negative. He does not have any pain or tenderness in his calf at this point in time. Next thing that I'm going to do as well is I'm going to do a good skin assessment. So I would have him turn to his side. I would look at his backside as well to ensure that he doesn't have any skin breakdown on his bottom or in that region. I'm going to have him squeeze my fingers here, and he does have equal grips on both sides. I'm going to palpate his radial pulses on both sides, and they are equal and strong as well. I'm going to check his skin turgor. Okay, it's best really to do it on the chest versus on the arm, just because we lose that elasticity. So I'm going to check that, and his is brisk. Okay, it's not tenting or anything like that. He appears to be well hydrated. Lastly, I'm going to be sure that he's comfortable. I'm going to be sure that he doesn't need anything at this point in time. If I wanted to assess his range of motion, I could have him raise his arms for me, and we can see that he could move his legs throughout the assessment. So I would say he has active range of motion. Okay, we could also view his gait and things like that when he gets up to the restroom. And that concludes our head-to-toe assessment.